All right. Well, the Supreme Court today modified its 8th April order that testing for coronavirus be made free at all labs, whether it's government or private. And the Apex Court has said that free testing will be available only for patients belonging to the economically weaker sections and who have the Ayushman ID. They've also made it clear that private labs cannot charge more for testing than the prices set by the government. Now remember, this observation has basically come after the ICMR filed a petition urging the Supreme Court to reconsider its order on grounds that private labs would find it difficult to carry out tests free of cost. Now we are joined by Dr. A. Velumani, Chairman, CEO and Managing Director of Thyrocare Technologies. Dr. Velumani, thank you so much for joining us. I just want to get in your take on this, on this amendment by the Supreme Court. Essentially, I remember that you as well said that you as well were of the opinion, obviously, that private labs will not be able to do tests, period, free of cost. Now, of course, labs just have to do so for the economically weaker section of the society, which I suppose seems fairly reasonable. Just first want to get in your opinion, sir.
Yeah, I am happy that the Supreme Court has segregated the really poor from the rest. And it has said that Ayushman route is reimbursable and poor can avail that. But having said that, laboratories are not directly connected with Ayushman. Hospitals are only directly connected to Ayushman. And we will be, as of now, getting business through the hospitals only if they are poor, because there is no mechanism by which we can directly deal with poor, because we are not connected with Ayushman. Having said that, it was an intelligent move, probably wise move, that of the testing community, 90% is rich, only 10% is poor. So this will save a lot of money for the government. Otherwise, they will be paying for the rich and richer and richest. So I personally feel this is very much essential. This could have been stated by Supreme Court in their first verdict itself. Now they have modified it. The pathologists are happy, laboratories are happy. I think poor also are happy according to me. But then we have to see how long this credit cycle is going to take, because we are not directly connected to Ayushman. Through the hospital it will come, and how long hospital will take it to clear us. These are all big challenges.
Okay. Now, of course, Dr. Velumani, private labs would still not be able to charge more than what the government has allowed. So basically, the government has capped the cost of testing, sir. Do you think that the amount at which it is capped is feasible for labs as well to be able to conduct tests?
Feasible, comfortable, doable. These rates are feasible. We can certainly do it, and it is a doable rate. There is no need to look for a bigger rate, because the volumes are high, and volumes will help us to optimize the cost. And I don't think laboratories are grumbling that these rates are low to operate.
Okay, so the current rates at which the government has set testing is okay. There's no such complaints as such from the private laboratories, and because of the fact that the demand for these tests are high, leverage essentially kicks in, and hence the cost as well goes down. Dr. Velumani, I just want to talk to you about the reach so far. I mean, what is it in terms of number of tests that you are able to conduct in this week? How many have you conducted versus, let's say, in the last 7 days? I mean, I'm sure there's been a spike, right, in the number of tests as well?
Yeah. Whatever we have done in the previous week, we have done literally 10 times more in this week. To that extent, we could scale up. But don't expect the scaling up will continue for too long, because we had a limited capacity. Our capacity were not used, and then last week it were underused, and this week they have been optimally used. A very little only more is the capacity. There are challenges in increasing the capacity, because you need to take approvals, you need to have an infrastructure, you need to create that infrastructure. All are going to take time. So it is likely everything will get optimized after a couple of months of operation. Without capacity, we won't be able to support in too big quantities in testing.
So currently, Dr. Velumani, what's the maximum capacity that you would be able to deal with, and at what point would it become too much, sir, to handle?
Currently, we have a capacity of around 500 a day. Ever since we got into it, we have installed some more analyzers. So today we have a capacity to touch up to 1,000 a day. So 1,000 a day with 100 players across the country, all may not have 1,000, but there are some people who don't work more than one shift. We work all the 3 shifts. In fact, government should seriously look into, are these government hospitals blocking? Are these government hospitals underutilized? When there is an emergency, why government hospitals cannot work 24/7? Sorry, I may not be knowing if they are already working. If they are not working, there is a room to increase the capacity. And I must tell you, the capacity in the country should be somewhere around 100 into 100 per day, 10,000 per day.
Okay, Dr. Velumani, we understand that we are also seeing a lot of individuals not exactly, they are asymptomatic carriers of coronavirus. But of course, in a country like India, we don't really see people going forward and getting themselves tested, even if they have minor issues. But sir, are you seeing such incidences in India as well, where we are witnessing asymptomatic cases, where basically an individual is a carrier, but he or she has no idea?
No, the challenge is all asymptomatic, if they test all symptomatic, will not get adequate opportunity to test, because it is a challenge. Currently, capacity is a challenge. Too much supplies of reagent are also not there. So if somebody is not testing early, especially in COVID, it is not going to be a serious matter, because the diagnosis truly doesn't alter the treatment. It only helps to quarantine him from the rest of the family or colleagues or whatever it is. So testing is very important, whether an environment in which a particular individual can be there or he need to be quarantined. So having said that, COVID testing, who to test, when to go for a test, all will get evolved over a period of time. Currently, a lot of confusions are there. Even government instruction who can test is challenging, because every day they keep changing about what is the criteria. But my submission is, if you have symptoms, please test. If you don't have symptoms, please don't waste the reagents.
All right. Okay. Dr. Velumani, thank you so much for joining us and, sharing with us your take on the latest coming in from the Supreme Court with respect to the pricing of COVID tests. An alteration really coming from that previous order that asked private laboratories to not charge anything at all for any kind of patient. Now, of course, it's limited only to the economically weaker section.